Well, good morning and welcome, everyone. Jim Brett here at the New England Council. Hope you all had a relaxing and enjoyable weekend. And we're honored that you're able to kick off your week here at the Council. We're winding down for the year. It's been a busy year, to say the least. In terms of our virtual programming, we have two other events this week that I wanted to remind you of. I think all in all, we probably did 70 of these virtual events this year, which is extraordinary. Tomorrow, we will hold a brief virtual annual meeting for the purpose of formally electing our newest board members. We hope to be able to do this with all of your support at 12:45 p.m. tomorrow. So this is our annual member meeting. It's very important that you participate in this. And then on Thursday, we'll once again host the CEO of ISO New England for a regional energy outlook, Gordon Van Wheelie. But today, we're delighted to be hosting the fourth installment of our new Inside the Corner Office series. And this new program has been very successful so far. And our first three events featured the CEO of American Tower, Tom Bartlett, the president of National Grid US, Bada Khan, and the CEO of the New England Aquarium, Vicki Spurl. But today it is my honor to welcome Dr. Ann Klibanski, the CEO of Mass General Brigham, formerly known as Partners Healthcare. Mass General Brigham is a not-for-profit integrated healthcare system headquarters here in Boston, and it's the state's largest private employer. Founded by Brigham and Women's Hospital and Massachusetts General Hospital, two of the nation's leading academic medical centers. The system includes community and specialty hospitals, a managed care organization, physician network, community health centers, home care, and other related services. Dr. Klibanski was named the president and CEO of Mass General Brigham in June of 2019, making her the first woman to lead the organization. She previously served as the system's chief academic officer and as chief of neuroendocrine. She's nationally recognized for her high impact research on neuroendocrine and also pituitary tumors. And try saying that 5 times. Dr. Klibanski, thank you. Thank you for all that you do. Thank you for joining us today. And at this critical time in the history of our nation's healthcare system, boy, there is so much to discuss. So please, let's get started. First, tell me a little bit about your background and your career path. The reason why I ask you this is because I have heard that you came to Boston from New York for what was supposed to be just a short period, a few years, but you ended up staying, becoming a Bostonian. I love telling my friends in New York about that great story that you have. So please tell us what brought you here and what has kept you here and what has made you a New Englander.
Thanks, Jim. So first of all, a pleasure to be here and a pleasure to join all of you this morning. Yes, what you're saying is completely true. I was born in New York City, spent a significant amount of time in New York, went to college there, medical school there, house officer training. And when it came time to really continue my training, I looked around the country and clearly the best place that I wanted to be was here in Boston at the institutions that we have, which is now part of Mass General Brigham. Coming to Mass General as a trainee was a really phenomenal experience. I wanted to be at a place in training and for training where I could have the very best of the scientific knowledge of the clinical experts and of the possibilities to really do whatever I could to bring together patient care and research to really promote the very best in patient care. The question of why I stayed, I think, is an easy one to answer. Well, first of all, I just fell in love with Boston. So there are very unique characteristics of Boston, as much as I love New York and still do, that are really phenomenal, just in terms of the city and the people, the wealth of universities, different places, different things, just a very, very wonderful, wonderful and smaller city, which I've really come to make home. But I think the other point is this, to me, it was coming to a place that enabled innovation, that enabled ideas to be brought forward and actually scaled up. And I'll probably get into that a little bit later in the talk, but I would summarize it as saying this. At the time I was there, I just became really interested in neuroendocrine and bringing together clinical care across a number of disciplines: neurosurgery, endocrinology, surgery, radiation oncology, psychiatry. And that vision of putting so many different disciplines together in terms of providing the very best clinical care and research in what became neuroendocrine, that was enabled, that was encouraged. So this concept of taking an idea that ultimately will help patients and being able to develop that at an institution, that was just something I could not walk away from. And I think, as we all recognize, the people there, their dedication to taking care of patients, their connection to each other is just remarkable. So you put all that together and voila, you become a Bostonian, and that's what I am today.
So your background being the chief, academic officer, as well as doing all that research, that has really prepared you well to take on this role as CEO?
So I think, Jim, in thinking about the chief academic officer role, it was really overseeing all of research and education across Mass General Brigham. A couple of points to just emphasize on that is, if you look overall at research across our hospitals, it's about $2 billion. So when you look at Mass General and the Brigham and our specialty hospitals, McLean and Mass Eye and Spalding all together, predominantly Mass General and the Brigham, you're talking about the number 1 and 2 best funded NIH hospitals in the world. And if you put it all together, it's really the number 1 recipient of all funding really throughout the world. So that research base is so fundamentally important to who we are and our identity, as is training as a mission. So during those years as chief academic officer, I'd say it accomplished a number of things. Number 1, it really enabled providing how we take the very best research and innovation that goes across the thousands of researchers and the thousands of clinicians and bringing it together. How do we take that research and have it really inform the very best, the latest in patient care, particularly in terms of tertiary quaternary care at our AMCs. So that in and of itself was really important. And the second thing was really understanding the power of the system. How do we do things at scale? And bringing together all of that research across the system, new platforms, new ways to think about things, fundamentally important. And where the system is going today, which is really an integrated academic healthcare system, really leading the way into the future of healthcare. So I'd say that time that I spent being chief academic officer was really instrumental in, again, bringing things together across the system, not competing with each other, but taking the best of where we are across the system. And I would say it again, taking that research, taking that innovation, and really being at the forefront of delivering that best care. And also having more impact, not only in terms of the patients we serve now, but in terms of looking nationally and globally. There are so many things that have come out of our system, new therapies, new devices, new diagnostics, that have really enabled us to have impact on millions of people around the world. That's fundamentally what makes our all of the academic medical centers, but particularly, and I say this with great pride about Mass General Brigham, that's the identity of what we are in terms of the state, in terms of the country, and being able to deliver these things at scale for the benefit of patients. I think that was so embedded in my years spent as being chief academic officer that it was kind of a natural place for me to transition into the current role I have.
I would just give a commercial to the New England Congressional Delegation. They are such strong supporters for research funding for your academic institution, as so many throughout New England, but we're blessed to have their advocacy, and it's made a difference, obviously. There are a lot of firsts in your bio. First woman to be named a full professor at Harvard Medical School, first woman to lead Mass General Brigham. Can you comment on what it feels like to lead the way in such an important field?
So I think in terms of a lot of these firsts, it's always interesting when people look to you as being the first in this and the first in that. And, I would say again, everyone is looking at everyone to be a leader, to be a role model for many, many, many different people in many, many different ways, depending on where you are, where you come from, what your background is, and who you are. I would just say one thing, Jim. When I was first appointed to this role as CEO, people said to me, "Well, what are your thoughts about being like the first woman CEO of Mass General Brigham?" What was Partners at the time before we changed the name? And I said, "Well, my one comment is I'm looking forward to the day when subsequent CEOs are named and no one thinks whether or not they're the first woman or the first anything. In fact, across all industries, we'll have really reached a very important point where one doesn't say, here's the first woman, here's the first anybody. It really is looking across and really finding who the best person is, who the best leader is for an organization, for really any business, for anything that we're doing, whether it's in healthcare or writ large, and really seeing it through who is the person, what do they bring to it. And also, I think understanding, as we all do now or should, that people from different backgrounds, people with different experiences, people with different identities, they're always bringing something very different. And, one of the things, Jim, one of the things you learn very early on in research is the best of research and the best of clinical work is taking people who are fundamentally different. They have different perspectives, different ideas, different backgrounds, different identities, and you bring them together, and collectively, that's where you can have the most power in moving things forward. You see it in research, multidisciplinary, interdisciplinary teams. You see it every day in the clinical world, bringing together the right team of specialists, but who all are thinking in a singular way around a patient. And I see leadership in very much the same way. You bring together the right people, you have the right person, and that's really where you make progress. So that's kind of how I see that, Jim.
Great. Now, just shifting gears, let's talk about some of the issues that Mass General is grappling right now. Just over the past 2 weeks, we've been learning more and more about that newest variant of the coronavirus known as the Omicron variant, which has now been detected here in many states in the country. What advice do you have for the public about how to best to protect ourselves against this new variant?
So, Jim, I just start by saying that this is what viruses do. They live to replicate, they mutate. There's so many precedents for viruses doing that. So the fact that there have been so many different virus variants and that these variants take over is no surprise to really anyone who has watched viruses for many, many years. I'd say a couple of things. Number one, I think for the general public, there is a difference between transmission, which is how contagious something is, versus how pathogenic it is, which means how likely is it for you to get sick. And the thing that we are still waiting for understanding is we know that this particular variant is highly transmissible, i.e. it is highly contagious. So it will likely take over. It will likely take over as the dominant variant at some period of time. We don't know what that looks like, but we've seen that with other variants that have come forward. We certainly saw it with Delta. Here's the critical question. Is it more likely to cause symptomatic disease, illness that leads to hospitalizations? And there are some early signals, there are some early studies. We do not know that yet. So the unanswered question is, what is the actual impact this will have on hospitalizations? We don't know that yet. We think it may impact the response to antibody therapy. Here's the bottom line. What the public needs to do is do the same. Stay masked, follow precautions, get vaccinated, get boosters. That's what you need to do. And I think if we follow those rules, we will be at the very best place in terms of protecting ourselves, protecting our families. That's it.
This pandemic has also really shined a light on the longstanding barriers and inequities in our healthcare systems. And we've seen that in communities of color impacted by that virus.
Yeah.
You talked to us about some of the steps that Mass General Brigham has taken to ensure equitable access to healthcare and improved outcomes for people of color.
So, one of the things that we and others around the system, around the state, and around the country realized is how profound these inequities are, these health disparities are, in terms of our ability to obtain health, to communicate, to deal with food insecurity, housing, and just a whole variety of other things that have really, I think, been very clear. We've done a number of things, and I would say that during the pandemic, it was really wonderful to see our healthcare system come together with this singular focus. What can we do to best deliver care to underserved communities? And care was a very broad category. It was the thousands and thousands of care kits. It was the mobile vans, delivering information. It was the switch to vaccination. It was all of those things that we were able to do together. So I would say a couple of things. Number one is just improving data collection and really understanding what these communities, who are these communities, how do we best partner with them, what are the best things, and what are the needs. It's the data on race, ethnicity, language, and social determinants of health. It's also strengthening our interpreter and translator services because so many people were not native English speakers, and how to reach those people is really important. We're working on new digital access programs, so that's important. It's also the elimination of what's called racialized medicine, and those are the kind of inappropriate use of race distinctions to make clinical decisions. So that's been a really important focus of equity in terms of either kidney function or lots of different things. We also have established a culture of equity improvement throughout the organization, very robust primary care programs to address chronic disease. I would say that a couple of areas just to highlight. Number one is large programs in terms of cardiovascular health, in terms of looking at substance use disorders and mental health. And I would say that we have, as you know, recently made a $50 million investment in what's a very new comprehensive community and mental health strategy. And the reason I want to emphasize that is we are in a mental health crisis across the city, across the state, across the country. So this will address a couple of different things. Number one, it's the pipeline for mental health workers. So when you look at access to care and access close to home is something we are very, very focused on as an organization. How do we deliver access? And part of access is being able to deliver services. So the pipeline of mental health workers, and that goes beyond psychiatrists and psychologists to social workers and so many others who are important in that. That is where we are partnering with lots of different schools, community colleges, in underserved communities, lots of different organizations that are already there who are working in communities to deliver a pipeline of people. So we're working on that, food insecurity. So I could go on and on, except to say that fundamental to the core of who we are and what we're doing is a very broad-based social health equity program to really deal with these multiple disparities. These are patients that we serve, and we are committed to doing it in any way we can.
Mm-hmm. So what do you see as the future of healthcare? There's so much change going on right now, but give us your perspective of where we're heading.
So I would say that the future of healthcare is a topic we spend a lot of time talking about across Mass General Brigham and certainly across the state and the country. A couple of really important things that I want to note, Jim. One is there are massive, massive disruptors in healthcare that are occurring all the time. And many of these were occurring clearly pre-pandemic. We see many, many large for-profit companies getting into healthcare very quickly, whether it's Amazon or CVS or ZocDoc. Healthcare delivery is being transformed every day. And so much of that is being done by large companies that are not-for-profit. So our challenge as a leading not-for-profit academic system is, how do we take the best of who we are and what we can deliver and do it so that we can provide the best care for patients in a way that's convenient to them. So if you look at a lot of these disruptors in healthcare, they are looking at things from a very patient-focused perspective. And that, even though we've all of us in hospitals and healthcare settings across the country are committed to that and have been talking about for so many years, that patient-centric focus, the voice of the patient in that experience, is more important than ever. So I would say, if we take the best of what we see going on, but really say, we here in Massachusetts, as healthcare industry, we as Mass General Brigham, as a leading healthcare academic system, what should we do? We have to take that best of patient experience so that patients can have an easy portal. They can get on an app and make appointments. They have access to the kind of care they need. They can go around the corner and get the care they need. So for us, it's delivering across the full continuum of care to improve patient access and experience, to reduce costs, to take those academic medical centers, those leading centers, Mass General Hospital, Brigham and Women's Hospital, and have the sickest of the sickest to go there. That's what we do there, and that's more expensive. And there will always be people in those communities around those hospitals who need to come to the Brigham, to Mass General for their care. But that secondary care, that needs to move out of our AMCs. And even before the pandemic, where we have now 50, 60, 70 patients waiting to come into our hospitals who are really sick, they don't have room. That secondary care needs to be moved out into community hospitals, into ambulatory settings, into the home. And we have invested a lot in technology to enable that service to be provided. So that's the strategy that we're all doing, getting that highest quality care closer to home, getting those patients who don't need to be at our high cost academic medical centers, putting them in the community hospitals and putting them in ambulatory centers very, very close to home. And, I think, as you know, we have proposals to enlarge Mass General, which is always at full capacity. And Jim, one of the things we've learned during this pandemic, and this is not the last time we are going to see a crisis in healthcare, not the last time. We need to have more beds. We need more beds throughout the state. And for us, we need more beds at Mass General. We need to take those, double rooms, which dominate the whole facility, some of the same floors I trained on, and turn them into single rooms. So we absolutely need to do that. And we need to have a state-of-the-art building where patients can come to from around the country and be so proud of. And at Faulkner, again, Brigham Faulkner, that's a community hospital that needs beds. We don't have any room there. And really important to all of this is eye care. And that is taking the 227,000 patients, that's like 15% of our patients who live in these neighborhoods, 227,000 patients, and enable those centers to be built. So if you live in Westboro or Westwood, you do not have to drive, take a day off of work to come to a more expensive site. You should be able to get that care, whether it's primary care, secondary care, mental health services, which we're really focused on. You ought to be able to get that quality care around the corner and not come to these high AMCs. So we are looking at the future of healthcare, and I would summarize it as follows. The future of healthcare is to provide the right services in the right places. So the movement of secondary care out of those highest end hospitals for that tertiary quaternary care is going on around the country. It has to be done. People want to have the best care delivered near where they live at a lower cost. So getting at community hospitals, getting that out into ambulatory, and getting that out into the home. The home is the final frontier. It's where things begin, and it's where things end. So it's the community and the continuation and the continuum of care, which really is the future of healthcare. And I would say one more thing, the importance of technology as an enabler cannot be emphasized enough. The technology has always been there. We went from a few thousand Zoom visits to over, I think it's 4 million now across Mass General Brigham. Telehealth revolutionized the medicine. Who would have thought that 2 years ago? No one. That technology was always there. Didn't get invented because of the pandemic. It's the adoption of the technology, and it's the furthering of that really to provide the best care for patients. So that's where healthcare is changing. We need to be so mindful of the cost, but we need to be smart about it to deliver the best care to patients and have them be able to choose where they want to go. So I'll stop there because I'm very passionate about this. I think we're all seeing the world as being so fundamentally different than it was 2 years ago. And I think for everything that we're doing, whether in healthcare or in any other segments of the economy, we would all be very short-sighted if we didn't realize that the world has fundamentally changed.
Well, I'm glad I asked you that question.
It's at the heart of where we're going in healthcare.
Yeah.
That is really at the heart of it. How do we envision what healthcare looks like in 5 years used to be a popular topic. Now it's like, how do we envision what it's going to look like in 2 months? Because it's changing so fast. We have to do the right thing for patients, Jim.
Good. Well, finally, it's been a busy year in Washington as Congress and the White House has responded to the pandemic. With the pandemic ongoing, as you already said, the hospitals are full and the providers are exhausted. What are the 2 or 3 things that you think the federal government could do to provide some relief to the healthcare systems in the near term?
So I think that, in terms of the federal government, there are many, many things that we can do to make things better. I think one thing, and Jim, you've said it well, and I'll just emphasize this. All of our healthcare systems are really very fragile right now. I mean, we have incredibly resilient workforces. We have incredibly resilient people who have really dedicated their lives to taking care of patients. But the upheaval has been massive, massive. People are exhausted. They are exhausted, and they are fearful of change that will hurt how they can best deliver care. So, I think in terms of the government, we're in a national public health emergency right now, and that enables us to do a lot of things to manage, surge capacity, address some of the workforce challenges. If we knew that was going to be continuing, that I think would be a huge relief for all of us, because we are all of us in healthcare are so worried about our workforce. Who is going to be there? Where's the continuum of care? We're seeing such a change in employment, as I know all segments of society have. But, if you're running hospitals and you're thinking about the impact on nurses, there's such turnover in nursing throughout the entire country. We are not immune from any of this, even though, again, I think we all, and I certainly take such great pride in the resiliency and fantastic work of the workforce. So continuing that relief to the healthcare system in terms of continuing that national public health emergency, I think, can't be emphasized enough. I think the other thing is really to make the continued commitment for whatever is an expanded coverage provision. Those things are also really, really important. Along with things that are related to social determinants of health, housing, for example. All of these things are really critical to the health of patients. The other thing I would flag, which is just something that comes up all the time, is what we have learned in terms of the ability to deliver telehealth. And I alluded to this before, but for example, telehealth in behavioral health, in mental health access, has just been so critical. It still dominates the majority of calls still in terms of behavioral health are delivered via telehealth. And, without some congressional action, we're going to see a decrease in Medicare coverage for telehealth services. I think the other thing that's really challenging is the geographic restrictions and licensure. So what that means is if you're a physician, if you're a caregiver licensed in Massachusetts, and you're taking care of a patient for many years, and maybe they're a student and now they've moved to another place to go to college, or you're taking care of someone and they've moved to another state, you can't see them anymore. And this is incredibly disruptive for patient care. And there are so many areas where we provide services where all of our hospitals across Boston and the state are providing services. Once you get back into this crossing state lines or you're not licensed, this presents an enormous burden on the clinician, but most of all, it is fundamentally problematic for patients. So I think, being able to understand that and eliminate those sorts of issues, I think are going to be really, really important, because otherwise we are going to lose a lot of that power of telehealth. And if we're thinking again, to your question about where is healthcare going and how do we best deliver healthcare, if we are stuck with those rules and everyone has to get licensed in this state and this state and that state, and all of these disincentives are put into place, we're really going to hurt the future of care. So I think in terms of thinking about capacity and access and the best care, anything that can be done at the federal level to move that along and keep us in that emergency place is actually going to be most beneficial for a lot of the care that we have.
Is there anything else in the bill that just passed the House, the Build Back the Better bill, that's now in the Senate, and it's going to be debated? It's going to be slimmed down, but is there one or two items in there that measures that really expand the healthcare that you would embrace to say, well done, do it, and it'll make a difference?
So maybe let me pick a couple of areas, Jim, to be very specific about. I think the expanded coverage provisions are really important. That's just important to note. Most notably, the extension of the ACA expanded subsidies for 2 more years. I'd say that's the first one. I'd say secondly, and I can't emphasize this enough, are the significant investments made in the Medicaid program, very critical. And that includes enhanced funding for states like Massachusetts. There's $150 billion in home and community-based care programs, investments in community behavioral health clinics. And I think third is something I alluded to before, and these are kind of areas of social determinants of health. And I want to again highlight the importance of housing. So there's a substantial amount of money in there for a variety of federal housing programs. And again, I think if we look at social determinants of health, we often use this phrase when it comes to food and nutrition, which you've probably heard is food as medicine. Access to healthy food is such an incredibly important part of health. You can also extend that in housing as medicine. In my so many years taking care of patients as a clinician at Mass General, you would sometimes make a plan with a patient. You'd write prescriptions, and then you'd find that they didn't have a home, or they were living in someone's garage, or they were trying to find a place to live. And it's a different world of care when housing and food are fundamentals to healthcare. So I want to just emphasize the housing programs, because I think sometimes people don't actually associate that as being such a key thing when we're thinking about the health of our communities as healthcare delivery systems. But it's right up there with all the other things that we're thinking about and worrying about in terms of taking care of patients.
But Mass General Brigham, you've also committed to working with local organizations to fight hunger. Can you tell us just a little bit about that effort and how it's going?
Yeah, I think in terms of the food efforts, I think a lot of that started way back during the pandemic when, you know, we were working in so many underserved communities, and we were really seeing that need for food. So thinking about food again as medicine and how we can help deliver food was a critical point. Part of the community plan that we've been discussing in terms of funding actually is not only looking at the pipeline for jobs, which I've already mentioned, because that's critical, not only for fulfilling needs that are so important, but also in terms of a training vehicle and a job vehicle for so many people. But specifically when it comes to food, it's really, again, partnering with organizations in communities. I can't emphasize that enough. It's partnering with those organizations, whether it's La Collaborativa in Chelsea, there's a whole list of different organizations living in the communities, whether it's community health centers, whether it's groups within the community. It's learning about the needs of communities from those who live in the communities. And actually, I'm going to say the word again, it's the partnerships where we can be helpful in terms of really assessing and addressing that common need. So I think that, Jim, you're going to see a lot more of that to follow. But I think, you know, one of the main things that we have learned, that many have known really for many years, is you go, you know, think about the communities we serve, think about the communities and who in those communities, knowing the needs of the communities, knowing how things work, the relationship. And again, I'll go to the needs. How do we best partner? What can we do together rather than trying to recreate or create something that is fundamentally disconnected? And that, you know, I've seen in many years in different places across the state and across the country. We can't afford to do that now. There's just too much at stake, frankly.
Good. Well, our time has come to an end, and I just want to thank you for taking the time. I know how busy you are to join us today. To me, it was an incredibly informative conversation and extremely timely, to say the least. But I also just want to say a sincere gratitude to you and to the thousands of Mass General Brigham employees. And I know so many of them personally, but they've worked so hard to keep us all healthy over the last couple of years. I just want to say thank you to all of them. And again, keep up the great work that you're doing. And we have many, many viewers on today, but one of your biggest champions, Jack Connors. I don't know if we could have a discussion about Mass General Brigham without Jack Connors being on the discussion. He's your champion, he's your ambassador, and a great supporter of the New England Council. But to all of the other hundreds of people that have tuned in today, I just want to say thank you for joining us today. And we hope that you'll join us next month. And of all topics, it'll be the CEO of the Greater Boston Food Bank, Catherine D'Amato, talk about the food insecurity. And that's a serious problem here in Massachusetts, but also throughout New England. So hopefully you'll join us for that. But in the meantime, I hope everyone has a great week. Stay safe and stay healthy. And again, thank you for tuning in. And thank you, Doctor, for all that you do.
Thanks very much, Jim. It was a pleasure. And really, it's thanks to all of the people across Mass General Brigham who are working so hard every day. So thank you for acknowledging that. That's what matters.
Great. Thank you.